Um, this section, progressive medical conditions, if I were a test taker, I may want to know the difference between the two. I mean, so understanding what a progressive medical condition is and how that can compare and contrast to non-progressive is important. And one of the hallmarks of a progressive condition, really what defines it, is that it's getting worse, okay? If we look at a spinal cord injury real briefly, and that spinal cord injury happened at the 7th cervical vertebrae, that's where the condition lands. We're not going to get, we're not going to get involvement higher than that. We're not going to go up to C4 unless there's another injury. But with a progressive condition, we are getting worse, okay? So we're going to talk about some of those, how they present. One of my terms that I want to throw in is etiology. You may hear that. What an etiology is how did this happen? What happened? Okay, so when you think about etiology, always think what happened. What are some complications and concerns? So progressive conditions present a little bit different. We have to think about them differently. When we're in rehab, when we're working with people who have a progressing condition, and we're using assistive technology, we have to consider these factors. It's getting worse. How do I look at that? Okay. So those are some of our factors and considerations. So again, the hallmark of progressive condition is a worsening of symptoms over time. The disease or ailment is worsening, growing, or spreading at sometimes a changing rate. So what that means is it's not a straight line from here down. It is the stock market. It can go up and down on any given day. It can look worse on some days, and it can vary based on a lot of external conditions. I'll talk a little bit more about some of those conditions and what that might look like. I almost got ahead of myself, like how I caught that. So what are our considerations? How rapid is this changing? Okay. How does this change impact function? Because remember, function is really what it's at, right? Like that's what it's about, is helping somebody function within their life. So we have to be reminding ourselves, is this impacting their function? How quickly is it changing? And how does this affect our recommendations? If you have somebody with ALS and they're progressing extremely rapidly, you want to know that, right? Like you want to know that. If you have somebody with arthritis, it's kind of a slow, meandering disability that's getting worse, but some days are okay. That's very different. So, one of the things we're all doing that's a progressive condition, and we're not going to stop it unless we're at the finish line, and that's aging, right? Like we're all getting a little bit worse, or older, sorry. We shouldn't be getting worse. But these are up here some conditions that are classically getting worse over time. These are progressive conditions, and many of them are related to aging. If you look at the graph to the right of the circle chart, you look at arthritis at the top. Boy, oh boy, 45% of us, by the time we're 80, 85, we're going to have arthritis. That's a lot of us, and we need to know how to manage that. But if you take that same line and kind of draw it down, geez, some of us at 25 are going to get arthritis. And that's going to progress over time, and we need to consider that. Now, is it possible for people who have a brain injury to also be aging? Why, yes, it is. So that's something to think about. Like now we're layering things on top of each other, right? Like now we have somebody who maybe had a spinal cord injury, but they're getting older, and all of a sudden they're getting worse at whatever they were doing before. Maybe they had some arm function, but now all of a sudden they're not being able to use their arms as well as before. And it oftentimes is related to something like this. Okay. So I did mine just slightly differently because I wanted to talk a little bit about progressing motor conditions. This was hard for me to peel apart clinically, so bear with me because I'm doing it just slightly differently. Normally, I would talk about neurological conditions and orthopedic conditions, but because Stephanie covered a lot of the orthopedic conditions in non-progressive, I did it this way. Okay, so some examples are ALS, MS, arthritis, Parkinson's, and the etiology is either neurologic or orthopedic. Does everybody know what neurological conditions mean? Okay. Yeah.
What is ALS?
ALS, good question. That's amyotrophic lateral sclerosis, Lou Gehrig's disease, more commonly known as. So this is something that attacks and affects most often men, sorry to say. MS tends to be women. They're both motor neuron conditions. So when Stephanie was talking about your brain and your spinal cord and how they're connecting, they're all encased in this nice, beautiful, smooth sheath that acts like a conductor, if you will. And what happens in both of these diseases is a deterioration or degeneration of that sheath. And it's different, but I'm kind of trying to simplify a little bit. So those are both neurological conditions that get worse. ALS, has anybody known anybody who had ALS? And how is it? It's pretty devastating. It's absolutely horrible. It can be very fast. It can start out slow. It's almost like a freight train, like really slow. You get the diagnosis, and then all of a sudden it just takes off. And honestly, it's fatal. People don't recover from this. They lose function in their body to the point that they lose the ability to breathe on their own. It's very sad. MS tends to run a softer, more gentle course. That's coming from somebody who doesn't have MS. They would probably argue with me, and I wouldn't let them win every time. But it does progress a little bit slowly, and a lot of these conditions vary daily. They vary based on weather. And that's why I said I don't have it on here, but weather is often a big factor in a lot of these. If you know anybody with arthritis, how does the weather affect them, right? Like, you need to understand that if you've had 4 days of high humidity and rain, and then somebody's not going to function as well as they did. So the thing about these progressing motor conditions is we're losing strength. We're losing coordination, and that's impacting our function. I have to check if there's something else I wanted to say.
You said that women were more often affected with multiple sclerosis than men, but
Yeah.
it certainly does happen with men.
Absolutely.
My experience is they tend to be in a little more denial.
Oh, yeah. Well, sorry, guys. That can happen sometimes. It is, denial is actually a real thing for a lot of people when these progressing conditions happen to them. It's very hard. Even if we're talking about dementia, there's this spot when people are getting Alzheimer's or dementia where they become argumentative, and that can be a hallmark because they're actually self-aware and understand they're losing some function, but become very frustrated with themselves and very angry. And so oftentimes when they're having to confront their own disease process, it can lead to a lot of that, and it can look like that. And that's another thing to be pretty aware of. So these neurological changes that occur in the brain are affecting how we have our ability to balance and move, our coordination and our strength. And along with that comes safety. Prone to falls, all these conditions really, we see an increase in falls. And we need to be aware of how we are helping somebody in their environment. If we have stairs that don't have rails, we need to look at those things. Do they need a ramp? Do we need to go to a ramp, or can we just do a rail? But we should be considering them before we see people having multiple falls. That's always when I like to catch those kind of things before they sort of get out away from us. This may acquire adaptive assistance on the farm. you can't get across there. We're going to need to do some energy conservation. The farmer might have been able to walk to that close field before, but boy, if he can't, we're not going to want him to expend all his energy. We're going to want him to use a gator. We're going to want him to use some adaptive equipment to get from point A to point V, conserve that energy. Has everybody heard of the term energy conservation? Okay, perfect. So I like people to think about that when they're doing all these, because again, the hallmark of these progressive conditions is that they're worsening. So we want people to be able to have as much energy to do what they want. If you do everything on your good day and don't take those breaks like Stephanie was talking about, you're not going to be any good for the next 2 days. Okay. So we're going to talk a little bit about some medical conditions that fall under progressing, getting worse. Heart disease, COPD, that's chronic obstructive pulmonary disorder. A lot of our grandmas said emphysema. We say COPD now. Cancer, DM, diabetes. Why would I consider, does anybody have diabetes? Know anybody with diabetes? It's so common now. This is, again, a lot of the sensory things that Stephanie was talking about can progress with diabetes. Even with heart disease, we have some decreasing sensation in these areas that are going to impact function. They can impact strength and coordination. Some major considerations are endurance. Does everybody understand, again, the concept of endurance, being able to keep your energy up over time? With heart disease, especially cancer, all these, we have endurance problems. And we need to help somebody manage their day in a way to let them get to the things that not just they have to do, but that they want to do. Okay. Vision and hearing loss. Can we imagine how impactful this can be on the farm? Again, many of these can be age-related. Especially, well, not even just hearing, but vision as well. These changes that impact function with relationship to hearing and vision can often go undetected for quite some time. Again, there's some denial to them, especially if they're just aging degenerative changes. But we have really simple ways to handle some of these. We can use lights instead of just having to rely on noise. But if that farmer cannot hear machinery on or off, that's hugely impactful to their day. We need to modify that for safety. We have to be aware that as we're looking at these things, we may be there for a non-progressive condition, but we realize, geez, he can't hear me, right? So being aware of maybe these conditions that don't present as your initial reason you're seeing them, but are very critical to how you're going to implement your assistive tech, need to be considered, because I think some of the age-related conditions, I'm not sure Ned will speak to some of this, but we come across them as a layered condition so often. So it often isn't just the first reason I'm seeing somebody. I have a quick story to tell. You ready for surprise? So what I do now for Easter seals is I do a lot of their seating and mobility devices for people. And I saw somebody who had been successfully using a joystick for 40 years. He had cerebral palsy. He used a tilt and space power chair, and he got referred to our clinic, to us, to be reevaluated. And he could no longer reach his joystick, which meant he can't move himself. I mean, this is hugely impactful for his life. If you can't reach a joystick, you can't move yourself. He had a caregiver joystick in the back, but we were able to reassess him and get him a head array and taught him how to use the head array. And so he's been now successfully using that for a couple months. That was a non-progressive medical condition. His cerebral palsy hadn't progressed in 40 years. But all of a sudden, he got COVID, he was in the hospital, he lost function of his one arm he had function of and could no longer do that. So now I'm treating somebody who had this non-progressive condition, but it obviously had progressed to something different. So being aware of those variabilities within that and how you're going to interact with and interface people and anticipate maybe a worsening condition is probably one of the harder things, honestly, you're going to do.
Can you explain what a head array is?
Oh, sorry. Yeah. So the normal headrest on a chair is, well, not normal, but many headrests on a chair just have like an occipital or a small round support for the back of their head. But the head array, what we were able to do is incorporate temporal control of the chair so that he just with a head tap can go into a drive mode, and then if he taps right or left, he can function through. So he can tilt himself in space, he can, maneuver right or left, and actually once he gets in drive mode, he doesn't even have to touch it. It has like a sensor, so he just has to get close, and so if he turns his head right, he can go right. If he turns his head left, he can go left. If he leans back, he goes forward, and then he taps to go in reverse. But there's many ways you can program it, but a head array is basically driving a chair for somebody who has no other ability to move their chair. Normally they can't self-propel, and they can't, like he could no longer even use the joystick. So it's pretty cool.
And there might be other accessing system switches, if you will.
Yes.
There are some that are based on vision.
Yep. Eye gaze technology. Eye gaze technology is pretty amazing. We're working with a company to try and do some assistive tech communication pieces for people and interface them with the wheelchair. It's a lot to get covered. Most of my patients are Medicaid, so I have to write really good letters. Yeah.
One other thing in relation to what you were saying about hearing is that, and I don't know for sure, but I believe there are some hearing aids now that might be able to limit high decibels, because you have some people who say, I don't want to wear my hearing aids when I'm out working with the machinery because it's too loud.
Correct.
And so some of the, I don't know if they're better, more modern, whatever ones, may be able to limit that so that they can be encouraged to wear them all the time.
Yes.
And not leave them back at the house or something when they're going to be using machinery.
Yeah, so hearing aids technology has come really far, and they actually can look at the frequency of somebody's hearing loss. So we're actually looking at what frequency they're hearing within and can maybe tone out something or dampen down noises that would provide that feedback that people find so annoying. The other interesting thing is that, and I'm sure Soon-Lee tomorrow will talk a little bit about this, that technology is also in your cell phone. So if you get hearing aids now, most people, even just, this isn't even beyond what grandma can get tomorrow if she wants it. You can get an app on your phone where you can control your feedback. So if I'm in a movie theater and the sound is sort of surrounding me and it's too much, I can tone down my hearing aid right then and there. So they're so much more user-friendly. And because we don't want that. The last thing we want to do is provide something to somebody and have it sit on the floor in their closet and not be used. I think that's the one thing that most of us therapists and people who use assistive tech or help people use it are like, oh, no, like nobody wants that. So that's where tomorrow those good assessments come in, and, finding out if people are really, really buying in and want to use this, it's what they want. So yeah, good point. Thank you. So some of these progressive medical conditions are variables where their function can occur, and they can look like even daily fluctuations. I like to talk about, I think I mentioned before kind of that stock market effect, right? It's like, some days are really good and we're really up, and some days are bad. Weather fatigue, fatigue from prior activity, those are all really, really important considerations. The steady decline or trending decline of function and how that impacts what we're recommending. What does it mean for assistive technology? I'll just open it up. What are some thoughts on that? What are some thoughts about how you can, who here does assistive tech? Who is working in that field? Do you guys consider this type of progression of condition? Tell me. Give me something. What you got?
I've been working with a client from their onset diagnosis of MS. And while she was working still, we worked with text-to-speech software to help with the dexterity in the fingers.
Good.
And now we're progressing, and now we've started working at an additional mouse control that's more of a roller ball that has larger buttons to either
Perfect.
side.
Yep.
So it's just been kind of over time.
Yeah, this progression. And, who knows, she may end up needing eye gaze technology at some point. She may need, more advanced text-to-speech, depending on how her speech maintains. So, yeah, okay, great. Any other thoughts or comments? Yeah.
What's eye gaze?
So eye gaze is, there's an eye gaze company, but there's eye gaze technology, which basically is retinal technology. So I don't know, a lot of us have heard, using our iPhones. They use a lot of retinal technology now in iPads. But what this particular technology does is it allows you to gaze at something on your screen, and it can detect your time you're gazing at, like a number or a word, and you can come up with sentences, and then it can speak for you. Kind of like dragon speech. I don't know if anybody's familiar with old dragon speak. That was used a lot when I was doing pediatrics. We used it a lot in schools. But it's a way of getting someone who is nonverbal or limited verbal skills to be able to access most often communication. But now it can interface with environmental controls, which is super cool. So you could have a kid with CP that doesn't have, or an adult for that matter, that doesn't have the ability to talk, and they use a power chair, and we know they're smart. They've proven it. They've shown they know their letters and their alphabet, and they've learned, but it's really cumbersome to do finger points or to use old technology of like pictures, and this allows it to be in fast, real time, non-frustrating, coming up with sentences, coming up with full thoughts, being able to write their own papers, and it can speak it right back to them. Yeah. So. Yeah, there's a lot of different programs that do the technology that we're talking about. But this is just a really important thing to think about when we are thinking about assistive technology, is if these are progressing. Yeah, go ahead.
Another comment. That assistive technology is also progressive.
Correct.
So the things
Yeah.
that weren't available before suddenly become available, or things that, like infrared is such an amazing, simple technology, but almost all of the device makers have got away from it because it's old.
Right.
It is so useful for people with disabilities to have infrared technology available on their devices.
Yeah.
And Apple, in particular, has done a decent job of building in accessibility features that used to not be there.
Yeah, I agree.
So we used to have to order separate head mouse that would detect a person's head movement to select and hover on things on their screen, and now it's built into the camera feature if you know how to turn on the settings.
Yep.
On Apple.
Oh yeah, and also most of the eye gaze technology is using an iPad now, an Apple iPad, because it just has the speed, it has the hardware to support this, the programs. Most of them just automatically go to Apple. They really are. I mean, I hate to say it, whether you like them or not, they're kind of the leaders in terms of bridging the gap between technology that may not be accessible to the everyday person that is. So yeah, and they have some things that are being used, and I know they'll talk a lot more about that tomorrow, but I lost my train of thought. But yeah, there is so much.
You guys are taking over all my content.
Oh no, sorry. No.
Infrared actually is a technology that's used in most of the ID systems.
Yeah.
There's two infrared cameras generally for the kind of the leaders in eye gaze device vendors. They use two infrared cameras. They look at your eyes, and so I agree with the comment about infrared not being part of devices. It used to be that most Android tablets used to have an infrared blaster that you can use with controlling your see like companies have gone away with that, but I think it will come back because of the use of eye gaze. I think that it will become more of a consumer product rather than a medical product, which is
Yeah.
great.
Yeah. I think that's where we see the costs come down, is when all of a sudden it goes over from it being medical to consumer generated. Listen, we want this. More people want this, not just, the disability community. We want it to be accessible for everybody. So at this point, that kind of concludes progressive medical conditions. Does anybody have any questions about what it means, what they are, what they look like? Yeah.
Could you talk about the expected symptoms of Parkinson's disease? Because I'm seeing a lot of that with older veterans.
Oh, yeah. So, Parkinson's is, again, a motor condition, but it is coming from a degeneration in the brain. And it was on a previous slide where I mentioned aging and Parkinson's. So Parkinson's is difficult because, again, it is a progressing condition of neurodegeneration. So it is affecting the brain, the speech, movement. You see a lot of rigidity of movement, and that rigidity oftentimes is creating impacts and falls. I think it's interesting you mentioned a lot of veterans with Parkinson's. There's, many of our veterans were exposed to a lot of chemicals. And as Stephanie indicated, those can often affect the brain. Especially as we age. I find it interesting that we see these conditions come out, not just Parkinson's, but almost brain injury-like symptoms on top of the Parkinson's, with the Parkinson's, or even the Parkinson's standing alone, because of perhaps conditions related to what they were exposed to. And I know the VA is and does look at those things. What was their exposure in Vietnam and Korea? Did somebody have those? Because if you can tie those back, you deserve and have every right to have the VA supporting your medical condition, even in those cases, because there are times where it is creating an exacerbation or a worsening of those symptoms. Yeah.
My son's an RN in Indiana, and he said that they see a lot of farmers with Parkinson's.
Yeah.
And he even asked when I told about this conference, he said, oh, you guys should talk about Parkinson's.
I'm sure that's why Ned brought it up. Again, we're talking about a lot of chemical exposure. It's
Cancers, Parkinson's, there are
Yeah.
several things that can go back enough time.
Yeah.
That we're using the precautions farmers were.
No, and probably still aren't, unfortunately.
What are the functional limitations going to look like with Parkinson's?
So the functional limitations with Parkinson's are going to depend on where the disease progression is. So when you're at the beginning stages of Parkinson's, you may just see some rigidity, some imbalance of the conditions. You might, or the person having some imbalance issues, but you're also going to probably be seeing a lot of word find issues. It's going to show up in the inability to kind of recall and have some memory issues layered on top of that. So again, it's a progressive neurological condition. So it does impact both areas, motor and that cognitive function, like we talked about, that brain power, accessing. A lot of times Parkinson's has really good long-term memory, as does dementia, but that short-term memory, what you told them yesterday or last week, doesn't stick. Very classic hallmark is a real lack of safety awareness, lack of insight into any of their changes. And that can be scary for people who are working with people with Parkinson's or their family, Gosh forbid you bring it up because they're going to, just not see their changes because they see themselves walking. But that Parkinson's rigidity is pretty classic first sign. You're not going to see their grip doesn't quite look right. The way that they move their mouth when they speak may not look fluid and correct. So rigidity is a little bit different than when we were talking about spasms. Spasms tend to be like a muscle control issue, and rigidity is almost like a stiffening that occurs. It kind of is a bracing. Again, it's a motor condition that happens because of the changes in the brain in the Parkinson's diagnosis.
What would you think of a person with Parkinson's driving a skid steer loader or a piece of farm equipment in the field?
So, it's interesting because I always say when it comes to driving, whether it's a skid steer, a car, a four-wheeler, a young person who wants to get back on their jet ski, but they had a brain injury, if you, as their friend, caregiver, parent, child, are unwilling to get in that skid steer with them and feel okay about it, they shouldn't be driving. And that to me is the hallmark question that you should be asking yourself. I have been asked countless times by parents or by children of aging people, should my parent be driving? And I'm like, well, you should drive with them frequently, and you should be willing to buckle up in the seat next to them and feel good about it. And if you can't, no. They shouldn't be. And that's a really tough conversation for a farmer. I mean, geez, salt of the earth farmers, they are not going to be receptive to that. We know that. We just know it. But you have a duty to express, and I've said this to patients, it is not my job to take the keys from you, or it is my job to give you my professional opinion, not for you to be happy about it. And you sometimes just have to do that due diligence, right? Like, you have to be the one to have the hard conversation and to say, in my professional opinion, you're putting yourself at risk and I'm not supporting it. It doesn't mean they're not going to do it, but I think sometimes we can decrease people's kind of wean them out of it, give them options, teach the family, have them be supported in other ways. Who can help you do this? Is there a space and a place for Grandpa to drive the skid steer out in the field without it being around anybody? But he can still get that without us crossing, 5-foot ditches where he could roll it. Maybe. And those are really tough conversations, but they're so critical, aren't they? Like, as you coming in as the AT professional or the therapist or, whatever your role is, we have a duty to talk to people honestly. And we can do it with care and empathy, and it doesn't have to be heavy-handed or punitive, but allowing ourselves to look the other way because it feels bad is not going to help anybody. So yeah, that's kind of a long-winded answer, but it is a tough question. And Parkinson's early on, maybe that's okay. But progressing Parkinson's, where we have, sort of a lot of motor rigidity, slow response time, decreased cognitive, that frontal lobe, executive functioning, probably not. It's not going to last too long. Yeah.
A couple of other things I noted is that it can be really hard on caregivers of
Yes.
people with Parkinson's. And that one of those is changes socially.
Yes.
Maybe not being willing to socialize anymore,
Mhm.
not letting people to come over, not
Yeah.
wanting to engage.
Even family.
Even family.
Yeah.
And the other thing, as far as driving situations, I believe that there are some good resources put out by some of the agencies that work with dementia.
Mm-hmm.
And so not just Alzheimer's, because there's more than one kind of dementia.
Oh, for sure.
But they have some, I think, good resources for families to use
Yeah.
and to sort of go through and look at
Yeah.
having those conversations, trying to decide.
The Area Council on Aging is actually pretty much in most communities. They are a federally funded group, but they're also supported at your state and local level. And many local hospitals have, if you really feel the need, they have drive simulators where you can take somebody and actually have that simulated. So, sometimes you're like, hey, okay, you think you can, and I think you might not be able to. Let's check it out. let's see if your doctor will write a script. Let's get you in. Let's get some empirical data here, right? Like, let's see what that says. And they can set up those simulators for you to try. So, yeah.
So one thing with AgrAbility is before we would recommend like maybe even a step or a lift or something for a tractor or ATV, that we make sure they have a driver's license.
Mhm.
Someone lost it.
Yeah.
They need to go test again, or again, like what you mentioned, is finding a medical professional to evaluate them.
Correct.
So we
Yeah.
want to have ER pay for something.
No, that's sticky. Yeah, I mean, I think we've all found ourselves in that position. I know that for me, it oftentimes is finding myself in the position of being the one who is evaluating somebody for a new power chair and realizing, oi, they have decompensated and now they have maybe an overlying aging diagnosis that is precluding them from being safe in their power chair. And that is not something you want to do. You don't want to take your wheels away from somebody. That's terrible. But we have to be aware that there's times where, you know, we have to keep other people safe. And we have, and I did, before I talked about the caregiver joystick, we have gone to that with some people to kind of transition people out of power chairs to that way, if they're having like maybe a day where their just motor skills are not functioning well, they are maybe having some behaviors because they're having a decline in their cognitive ability. They can turn off the power of their drive control, and caregiver can say, "Where do you want me to take you?" You know, it's not ideal, but it can be helpful.
There's another progressive disease that I've dealt with a lot, and maybe you can speak to this.
Sure.
Like a degenerative disc
Oh, yeah.
in the back.
Okay. Mm-hmm.
And if you could talk to us about what the therapists say motion is lotion
Yep.
versus overworking,
Sure.
and how to navigate that conversation.
Yeah, so degenerative disc disease, DJD, is when Stephanie was talking earlier about the spinal cord being encased in your discs, your joints. So what it looks like is two large, I wish I would have done a slide, sorry. Two large discs, or large discs stacked on top of each other. You have your cervical spine starting here, going all the way down, thoracic and lumbar. And a lot of times it happens in that low lumbar area. We have a natural curve, and there's a lot of force in those discs. And what happens is, if you kind of think about your disc like a jelly donut, right? Like the bone is kind of like the outside of the donut, but that jelly is in there. And that's what Ned was referring to a little bit. Motion is lotion. So it's kind of like, and this is a good farm analogy, if you leave the, the car out on the farm all winter, and you go to open that door in the spring and you haven't moved it, it's really rusty. But if you go out there weekly and you kind of open and close it and maybe, put a little WD-40 lubricant on it, you're going to keep that in better shape. And that truly is what mobility does for our joints. When we are mobile, when we move, we are naturally lubricating the articulations of our bones, okay? So I do find a lot of people avoid movement, and avoiding movement, especially in something like a degenerative disc disease where it's a degeneration of those discs, but it's painful, so you avoid it. If you can there's some great new techniques. Back doctors have done an amazing job of finding techniques that are non-invasive. They have some different techniques that they're using now where they can go in and scrape out some of the debris in there, almost like when they do an arthroscopic knee. They're doing that on the back now. So they're no longer having to open up the back and do this aggressive clean out. And those have been really successful with people. Getting people to the doctor before it has tipped over into a horrible mess is really important too. So if you notice people or have people who are starting to progress down this road with arthritis, because really degenerative joint disease almost is like an arthritic type condition, you can do a lot of service to them through encouraging mobility, encouraging strengthening, proper body mechanics. We didn't even touch on body mechanics yet, but that's huge on a farm. You know, so many people, men a lot of times included in this, you know, they're used to being young and strong and bending over and picking things up, but you have to do it in a proper way once you age, once you have these kind of conditions. And considering proper body mechanics is so critical. And so if you layer good mobility with maybe a good diagnosis and some medical intervention, whether it's, you know, pain management or other kinds of, like, I know there's some shots and some different like gel things that can be inserted into the spine. Again, see your medical doctor. And combine that with good body mechanics, prevention from a worsening condition is really, really important, especially when you're talking about like some of the motor, like arthritis and these degenerative joint diseases where they tend to be a little more orthopedic in nature. We can't control so much what's happening when it's a neurological, right? Like that's coming from the brain, and that progression is a little more variable.
So an indicator that someone is overdoing the motion is motion.
Yeah, so normal rest and recovery should allow you to continue your function the next day. So if I'm out and I'm doing a normal day of activity, I might get home and my feet kind of hurt and I put them up a little bit, and within an hour I should be able to get up, or two perhaps, and resume my function. If I am going out and doing so much that it's impacting my ability to continue on with my day that day or spilling over into the next, you've overdone it. And that goes to it's not up there, but that term energy conservation is literally what that means. Conserving your energy, because we all know people who wake up and are feeling great. I'm having such a good day. I'm going to do this, and then I'm going to do this, and then I'm going to do this, and I do them all, and I do them well. And then at 8 o'clock at night, I'm toast. I'm done. And then the next day, you're done again, and then maybe even the day after that. And conserving energy is really like thinking about your energy like I have a bucket, right? And it's pretty full, and I woke up today and it's pretty full. But if I dump out my bucket by noon, and then I'm like, it doesn't matter, I got to push on, and I'm going to do more, my bucket is not going to refill in 24 hours or 6 hours or 12 hours. It's going to take me sometimes 2 and 3 days. Have we ever experienced that with people where they're just like utilizing all their energy at the beginning of the week or at the beginning of the day, and then they have nothing left? And educating people about that can be really beneficial. Any questions? I feel like we need to stretch or move or something. Yeah.
Another thing for using heat, ice as
Yes.
part of that recovery can be very important. Hopefully not so much now, but there was a time where medications for pain might be prescribed, and that just has added to some of the opioid problems.
Yeah.
And so,
Yeah.
Using those non-chemical
Yeah.
rest and recovery kinds of things. is
Sure.
important. And stretching, and the other thing that farmers don't always realize is they're very good at using certain muscles, but they don't necessarily use all of their muscles to balance
Yeah.
their bodies. And so, as Leslie was saying, strong people, exercise program or some other programs might hit
Yes.
some other body balance, strengthening.
And honestly, being assessed by, a rehab professional, whether it's a PT or OT, oftentimes can do just that. I used to do that, I think I indicated before, where I'd go out and help train people on strengthening, mobility, balance, energy conservation, fall prevention. All those things can be partnered with optimally setting people up for their assistive technology use. because we can't ignore a declining condition. We just can't, because there are ways to help somebody strengthen their muscles. Their muscles are still their muscles, and their strength is still their strength. And if we can help, like, lay a groundwork and throw out like a, what am I trying to say? Prevention. If we can throw out a mat of prevention and help somebody from experience a true relapse. And also, I didn't mention a lot about people who have been diagnosed with cancer. That is a very debilitating, at times, progressing medical condition. But sometimes people recover just fine, right? But while they're seeking treatment, their life can look really different. And so that's super important, and often, and it can be layered upon any of those other disabilities. We all could be, just a step away from that. So understanding that when somebody's receiving treatment for something, that can be a game changer. Maybe they did have a condition for their degenerative joint disc disease, and they go to the doctor and they had a surgery. What that recovery from that looks like is going to be different than what they look like in 6 months, when hopefully they're getting back to their optimum, Somebody back had a question, I thought. Did somebody raise their hand a minute ago? No? Maybe.
I'll ask you.
No problem. That's okay. I totally understand that. So how are we feeling about understanding progressing medical conditions versus non-progressing? Some of the diagnosis, if I said, is arthritis a progressing medical condition, would you say yes? Okay, yeah, good. If I said a brain injury is progressing, would you say yes or no? No, thank you. Okay, so we understand. Good. All right.
However, there are often tendencies for re-injuries, or, you look at
Yeah.
the concussion research and
Yes.
those kinds of things. So I'm glad that you actually talked a lot about the aging process,
Yeah.
adding on to even the non-progressive.
Yeah, and those are, these are big chunks. And as therapists, we don't tend to categorize things like this, but it was important to kind of have a place of jumping off for all of us, to kind of meet with some language and some things that you're going to hear. We really like to look at where people are functioning. Function is really, for me as a therapist, where it's at. So.